Life sometimes come at you fast. Tragedies make your life unravel. You feel like you wanna give up and stay knocked down. Even when your heart is shattered, you still got a life to live. You still got a life to live, so don't give up. We are beautiful miracles. We are beautiful miracles. We are beautiful miracles, so don't give up.
Hello, everyone, and thank you for joining me today on my podcast, Beautiful Tragedy. If you like what you're hearing, would you please like, comment, share, and subscribe? And for those who cannot see us, we have a special guest here. Would you like to introduce yourself?
My name's Ivan.
This is my son, Ivan Schmidt. You guys have heard me talk a lot about him, and he's joining me today because who better to tell you some of the things that he's experienced and that have helped him than Ivan himself. So this is his first podcast, and he's very excited and a little nervous. So what do you think, Ivan?
Of what?
Well, what I wanted to talk about today with you.
Because I'm going to be my first video.
Yes, you're going to be in your first video. Yes. I know you're excited about that. But on a serious note, you know what we've talked about a little bit about, like you having anxiety. What does that mean to you to have anxiety?
I don't know.
Well, does it feel good or bad when you have it?
It feels very bad.
Okay. And what goes on? Like, does your heart beat fast? You get nervous and scared?
Yeah, all the time when I
You get nervous about like dogs and things like that?
yeah, I can't go out and in the backyard.
Right. And what else? What are some other things that you get nervous about in our house?
That there's bad guys.
And so then you don't like to go into rooms by yourself, right?
No. I can go in the living room, that's all.
That's it. Well, what do we do like when we don't know how to help you with how you're feeling? Who do we go see?
Dr. Ling.
And what do you guys do?
You guys talk for like 15 minutes, and then I play with her.
Do you like that?
Yeah, it goes really fast when I play.
Yeah. Yeah, she's got a pretty cool toy room, doesn't she?
Yeah.
And so, haven't we been doing something different the last couple times that you've been going to therapy?
Yeah.
I'm sorry, my phone was ringing.
Yeah.
What have we been doing?
What do you mean?
Do you know what that's called? Where you hold the little buzzers?
No.
It's called EMDR.
Okay.
And the reason that we've been going there lately is because some of the things you've been scared of have gotten a lot more serious, haven't they?
Yeah.
And we want to try to help you through that. And so, what do you tell me what you do when you go? Do you tell her all the things that you're happy about, or what?
I tell her the things that I'm scared about.
Oh, okay. That's good.
And that I'm nervous about too.
Right. And
sometimes I say what I'm happy about.
Yeah. Well, that's good. And so what have you guys been talking about, like a safe or something? Yep. So you drew like a little safe, and then she has you hold those little buzzers, right? And do they go like long or short or fast or slow?
I can do all of those things.
Right? And then she has you close your eyes and you think about different things?
We only did that once.
Right. Well, we're still in the middle of the process. So do you think it's going to help you feel a little bit better?
What?
Doing EMDR.
It already does.
Really? All right. That's what I like to hear. Well, that's good. What do you think started out making you scared about things? What was the really big thing that happened in our life?
Huh?
What happened to your brother?
He died.
That's sad, and we miss him, don't we?
I thought everybody knew that.
Well, anyone who knows us knows that, but there's sometimes people that don't know us that might be listening to this podcast.
We'll figure it out and want to follow us.
Oh, okay. Look at you. All right. I like it. Has there been anything else that's happened in your life that's made you scared?
Um, um,
What about,
I don't remember anything.
yeah, what about when your dad was sick?
Oh no, actually it did. But I was in preschool at that time.
Right, right. And so were you worried that he was going to die?
I really didn't know about that stuff.
Yeah, it's hard to understand when you're just a little guy, isn't it?
I was in like 4.
Yeah. Well,
Maybe 4.5.
yeah, I think so. Well, is there anything else that you want to say about going to therapy? Like, is it awesome?
When I get to play
Yeah.
with the toys.
Do you think it helps you?
Yeah.
I know it helps you. It helps me too. So if there's anybody out there that think that their child has something that they're really maybe a little bit scared of, do you think that they should do EMDR?
If they want to.
Exactly, if they want to. All right. Well, thank you so much for coming on, Ivan.
You're welcome.
Do you want to say anything else that's appropriate? All right. Well, thank you, Ivan.
Gonna be on the second one.
He's a little star. He's a little star. What can I say?
Can I be on the second one?
Do you want to stay here while I talk about the rest of this?
I'm
gonna talk about EMDR. I'm gonna explain what it is because some people might not know what it is.
Okay.
All right.
I'll just wave and smile.
That sounds great. So the death of your sibling at any age is incredibly difficult. They were the person that you thought you would celebrate all of life's major milestones with. They're your built-in best friend. They would be the person with whom you would take care of your parents when they got older. There really is no closer relationship because you are the only ones who are 100% related to each other. Losing your sibling at any age, losing your sibling at an age that your mind cannot truly comprehend can cause major anxiety. Ivan was only 3.5 when his brother died, very suddenly. Statistics say that kids developmentally cannot understand the permanence of death until they're 4.5. Ivan started experiencing almost debilitating anxiety very quickly after Jackson died. This was my first major call for help. I had no clue how to help him, and frankly, I needed help too. And then when you add the fact that Ivan's dad almost died 1 year ago, along with a worldwide pandemic, it has just been too much for his mind. Ivan's anxiety started kicking up recently after our dog got into a fight. And with his anxiety already high for various reasons, the situation really thrust him into sheer terror. He is now afraid to go into any room of our house alone. He gets terrified when he hears a dog barking. His brain goes right into fight or flight mode. It's been tough to watch, so rather than try to figure it out on my own, knowing full well I can't help him when his anxiety gets to this level, I reached out to his therapist to discuss Ivan receiving EMDR. Many people may not realize that kids can receive EMDR if they're having trouble processing something in their life. The clinical definition of EMDR, which stands for eye movement desensitization reprocessing, is that it's a structured therapy that encourages the patient to briefly focus on the trauma memory while simultaneously experiencing bilateral stimulation, which would typically be eye movements. And that's associated with a reduction in the vividness and emotion associated with the trauma memories. EMDR was developed in 1987 for the treatment of PTSD. The general course of treatment is 6 to 12 sessions, but some could require less. According to the APA, unlike other treatments that focus directly on altering the emotions, thoughts, and responses resulting from traumatic experiences, EMDR therapy focuses on the memory, and it is intended to change the way that memory is stored in the brain, thus reducing and eliminating the problematic symptoms. I always say I am not an expert. I'm only explaining my own personal knowledge and experience of observing Ivan while he receives it. At some point, I would love to have a therapist on the show to explain how it works. In
I have an
Ivan's
itch on my ear.
Okay, well, you can itch it. In Ivan's case, his therapist asked him to name all of his fears. He was able to do that very well, and I only had to add in a few things that I have observed. His therapist explained what they would be doing and let him hold the buzzers that they would use in each hand. There's kind of two different ways that it's done. Sometimes it's done with eye movement, where your eyes move back and forth, or also they have the buzzers that is what his therapists use. And so they vibrate, which is how the bilateral stimulation of the brain happens. And his therapist is able to change the duration and frequency of the buzzing, and he has been very, very comfortable with the process. She did a very good job of explaining it to him in terms that he could understand. She has him close his eyes and think about something in particular, and she also had him draw a safe that had a combination that they are working at figuring out how to put those memories in that safe. Through this process, they will work through some of the traumatic memories that Ivan has in his mind that he has been unable to process. We're still in the process, but so far I've been very pleased with how well he's been receiving it. So we have a few more sessions that we will be going to, but I thought it would be good to kind of have Ivan on here and he could kind of give his own perspective. So, yep. Because you're kind of an expert, aren't you?
Yeah.
Yeah, you are.
But.
Really?
Yeah.
Well, this is a 6-year-old. This is a silly little 6-year-old.
Gonna be on the third one.
All right. Well, as I wrap up this episode, I end the episodes with my favorite Maya Angelou quote is, "We do the best we can until we know better. And then when we know better, we do better." And so if you didn't already know that kids can receive EMDR,
Goodbye,
now you know.
I'll be better next one.
Thank you.
We are beautiful miracles. We are beautiful miracles. We are beautiful miracles. So don't